Thyroid gland problems, the ultimate checklist. 2 out of 10 people watching this video have a thyroid problem and half of them don't even know that, but they will at the end of this video. When the thyroid gland fails to function properly, it can lead to either an excess, hyperthyroidism, or deficiency, hypothyroidism, of hormones. Both of these conditions give away some urgent signs that your thyroid is in trouble. Also watch till the end for a very important health tip. 1. Sweating patterns. Hyperthyroidism causes excessive sweating, even in less active situations when you're not physically exerting yourself. A person with this condition would look for ice-cold water and fans in an air-conditioned room. Whereas hypothyroid patients would experience reduced sweating even if they were living in the Sahara Desert. 2. Struggling to regulate your body temperature. The hormones produced by the thyroid gland are essential for regulating body temperature. Any dysfunction in the thyroid can cause temperature intolerance, leaving you feeling either too hot or too cold. Those with hypothyroidism tend to feel cold as their metabolism slows down, while hyperthyroidism can lead to difficulty tolerating heat. So, pay attention to your body's temperature and take note of any changes that may indicate thyroid problems. 3. Appetite. Individuals with hypothyroidism often experience reduced appetite and sluggish digestion. On the other hand, hyperthyroidism can cause an increase in hunger. 4. Low bone density and fractures. Thyroid hormones are important for healthy bone development and metabolism in adults, but in cases of thyroid dysfunction, they can negatively impact bone health. Untreated severe hyperthyroidism can lead to rapid bone loss and increased risk of osteoporosis. Hypothyroidism, on the other hand, slows down bone metabolism and can also lead to decreased bone formation and increased bone resorption. Both conditions can increase the risk of fractures. Like, subscribe, and click the bell button to receive more valuable content. 5. Unexplained weight fluctuation. Sudden weight loss or gain that can't be explained by changes in diet or exercise is a red flag for a possible thyroid problem. Hypothyroidism slows down metabolism, causing the body to store more fat and making it difficult to shed off. It can cause weight gain despite a decreased appetite. That results in a swollen and bulky appearance despite consuming less food. Hyperthyroidism, on the other hand, revs up the metabolism and can lead to a ravenous appetite, yet the person may appear thin despite insatiable cravings, as the body tends to burn energy rapidly, leading to wasting and weight loss. 6. Changes in bowel function. Thyroid issues can affect your digestive system and bowel movements. Hypothyroidism slows down digestion and causes more water to be reabsorbed in the large intestine, leading to constipation. Hyperthyroidism, on the other hand, speeds up digestion and bowel movements, causing less time for water and electrolytes to be absorbed, resulting in loose or more frequent stools. 7. Hearing problems. Both hyper and hypothyroidism can cause hearing problems. Hypothyroidism in patients aged over 50 years, and hyperthyroidism in female patients, are correlated with an elevated risk of hearing loss. 8. Variations in heart rate. Low thyroid hormones can slow down your heart, called bradycardia, even if you are physically unfit. This may result in a heart rate of around 50 to 60 heartbeats per minute, typical for athletes and fit individuals. Conversely, if you have hyperthyroidism, your heart may beat faster, known as tachycardia, typically resulting in a heart rate of 120 beats per minute or higher. This can cause a pounding sensation and raise your blood pressure. If you are experiencing symptoms such as an irregular heartbeat or a racing heart, it is crucial to seek medical attention to evaluate your thyroid health. 9. Skin changes. Thyroid hormones regulate the renewal of skin cells. A sluggish thyroid function can cause a deceleration in the skin renewal process, leading to dry and flaky skin in hypothyroidism. In contrast, hyperthyroidism amps up the skin turnover way higher. Therefore, the skin stays warm, moist or sweaty, soft, thin, and papery. 10. Changes in the eyes. In hypothyroidism, there can be puffiness and swelling around the eyes. Hyperthyroidism causes swelling of the tissue and muscles around the eyes, causing the eye to bulge out and exhibit a protruding or wide-eyed gaze. This is referred to as exophthalmos. 11. Changes in the nails. Having hypothyroidism can cause changes in your nails. They may become thicker, brittle, and have vertical ridges. They may also be more prone to breaking or crumbling. Your nails may also appear rounder and your fingertips may be swollen. 12. An enlargement in the neck, goiter. When our body lacks iodine, the thyroid gland compensates by growing itself to try to absorb as much iodine as possible. This is the thyroid's way of compensation to produce enough thyroid hormones to keep our body functioning properly. That causes the development of a classic goiter in hypothyroidism. Goiter is not abnormal, but healthy tissue trying to perform its normal function. Hyperthyroidism can also cause enlargement due to tumors or nodules, but not as big as a fist-sized goiter. 13. Voice changes. Thyroid hormone imbalance can result in noticeable changes in the voice. Hypothyroidism can result in a lower pitch, slow speech, reduced vocal range, and increased vocal fatigue. Excessive thyroid hormone production can cause hoarseness. The person begins to feel difficulty making sounds when attempting to speak. 14. Changes in mood and energy. Hypothyroidism can make recovering from daily stress difficult, leading to persistent fatigue and low energy levels, even after a good night's sleep. Movement and mental processes may also slow down due to insufficient thyroid hormone in the bloodstream and cells. If you find yourself relying on multiple cups of coffee to power through the day, experience sluggishness and depression, an underactive thyroid may be the culprit. Hyperthyroidism results in an overactive thyroid gland, causing the body to function in overdrive. Symptoms include nervousness, anxiety, irritability, restlessness, hyperactive thoughts, mood swings, and inability to sleep despite excessive fatigue. 15. Hair changes. Changes in hair texture and hair loss can be a sign of thyroid problems. Hair loss is a common symptom of both hypo and hyperthyroidism. Hair loss caused by thyroid problems usually results in general thinning rather than bald patches on the scalp. With hypothyroidism, hair can become coarse, and a telltale sign is a loss of lateral or outer eyebrows, which women have to fill out with a brow pencil to make up for. Hyperthyroidism can also cause hair loss. The remaining hair is fine in texture. 16. Problems with memory and focus. The nervous system slows down when thyroid hormones are low. People experience brain fog. They complain of forgetfulness, difficulty concentrating, and impaired memory. 17. Changes in monthly periods. The thyroid gland plays a vital role in reproductive health. Thyroid dysfunction can disrupt the regularity of menstrual cycles. Thyroid issues can manifest in various ways, from heavy, prolonged, and frequent bleeding to lighter, shorter, less frequent, or even absent menstrual cycles. If women experience premature menopause before the age of 40, it is crucial to undergo thyroid hormone testing to rule out any underlying thyroid problems. Make sure to enable YouTube notifications on your mobile device so you can receive alerts whenever a new video is uploaded. 18. Depression and anxiety. The thyroid plays a vital role in regulating serotonin levels, which can affect mood. The underperforming thyroid is unable to do so. It slows down the nervous system and can cause brain fog and depression. A proper diagnosis of a thyroid condition would allow for proper treatment with thyroid replacement medication, instead of prescribing antidepressants. Hyperthyroidism, on the other hand, can cause anxiety, jitters, and tremors due to excess thyroid hormone production. This can make the body feel like it is in overdrive and may even result in panic attacks. It's crucial to treat the underlying thyroid problem, but traditional anxiety treatments can also be helpful for managing the symptoms. 19. Fine tremor. When the thyroid gland is overactive, it can disrupt the body's metabolic balance, leading to increased energy production in every cell. This excessive energy can result in nervous stimuli that cause hand tremors. To test for hyperthyroidism, one can extend their arms in front with palms facing down and observe fine trembling motions in the hands. This can be a potential indicator of hyperthyroidism. 20. Fertility challenges. Thyroid hormone problems can significantly influence fertility and reproductive outcomes in both males and females. Thyroid disorders adversely affect the ability to conceive and increase the risk of miscarriages and other pregnancy-related complications. In males, low levels of thyroid hormones can lead to issues with sperm production and quality. Thyroid hormone imbalance can disrupt the process of releasing an egg from the ovaries during ovulation, which can affect female fertility and lead to difficulty to conceive. If you are experiencing fertility problems, it is important to talk to a healthcare professional for a comprehensive evaluation and advice on the most appropriate course of action. Health tip. An important thing here to keep in mind is while the individual symptoms may resemble other conditions, the presence of a majority of symptoms occurring simultaneously in an individual raises strong suspicion of a possible thyroid hormone imbalance. Consider getting your thyroid checked if you experience many of the symptoms of thyroid imbalance. If you have any of these symptoms, please share your experience and what you have done to address them by leaving a comment below. Like and subscribe for more.